Hello everyone, today we will be studying the thorax. Let's begin now. Section Contents. The surface anatomy of the thorax, the thoracic wall and diaphragm, the lower respiratory tract and its role in ventilation, the heart, pericardia, mediastinum, development of the heart, respiratory and circulatory system. Chapter 9: The surface anatomy of the thorax. Introduction. Reference landmark. The anterior thoracic surface. This is the chapter contents. The surface anatomy of the thorax. Introduction. The thorax is the region of the body commonly known as the chest between the neck and the abdomen. The thoracic cavity is the hollow in the thorax that is occupied by the thoracic viscera, the heart, and its associated vessels in the midline, and the lungs laterally. The thoracic viscera are enclosed by the bony and muscular thoracic cage. The bony components of the cage are the 12 thoracic vertebrae posteriorly, the 12 pairs of ribs and their anterior cartilaginous extensions, the costal cartilage that meet the sternum anteriorly. The intracostal muscles fill the intercostal space is between the ribs and are involved in ventilation. Another muscle involved in ventilation is the diaphragm, a sheet of muscle that separates the thoracic from the abdominal cavity. If you are not familiar with the basic outline and arrangements of the circulatory and respiratory systems, refer back to the reading section. A good way to appreciate where these structures lie in relation to each other is to examine their surface anatomy. The position of internal organs related to features that can be observed or palpated felt on the surface of the body, relating surface anatomy to deeper structures is a clinical skill essential not only to the study of the thorax, but also of the structures in the head and neck, important in dental practice. Reference landmarks. In the clinical examination of the living subjects, the position of the internal thoracic organs is determined with reference to a set of vertical and horizontal lines running through the surface of the body. Landmarks. The significant vertical lines are shown as the midsternal line in the median plate anteriorly, the midclavicular line through the midpoint of the clavicle. 3. Mid-axillary line, midway between the anterior and posterior axillary folds, formed from skin overlying muscles. If you raise your arm while looking into a mirror, the two folds are obvious. They can also be palpated very easily, even with clothes on. Median posterior line. In the median plane anteriorly, the horizontal position can be defined with reference to the ribs or, less easily, the vertebrae. The anterior thoracic surface. Examine and yourself if convenient to do so, at the same time as reading the description. First you run your finger down the anterior midline of your neck. As you do so, you will feel the cartilaginous rings reinforcing the trachea until it disappears behind the sternum. You should now feel the suprasternal notch on the anterior margin of the sternum. If you move your fingers laterally from the notch, you will feel the heads of the clavicles on each side as they articulate with the upper part of the sternum. As you can see, the first rib lies deep to the clavicle and consequently is difficult to palpate. It is more practical, therefore, to start rib counting from the second rib. If you return your finger to the midline, the suprasternal notch, and run it vertically downwards in the midline, you will encounter the sternal cage, a ridge made by the point between the mandibulum and the body of the sternum, about 2.5 centimeters below the sternal notch. If you now slide your finger laterally, it will pass on the skin over the second rib and its associated costal cartilage. The second intercostal space is below the second rib and costal cartilage. Once the level of the second rib is established, it is simple to count down the successive ribs and intercostal spaces. Return to the midline and continue tracing the sternum down at the lower border of the sternum. You may be able to feel its short, sharp downward process, the xiphoid process. Once you get to this level, you will have to move your hands laterally to be able to feel the lower ribs and intercostal spaces. As you can see, in the costal margin, the lower margin of the thoracic cage curves down, and laterally, the costal margin is formed by the costal cartilage of the 7th, 8th, 9th, and 10th ribs. There are usually 12 pairs of ribs in all, but you will not be able to feel the 11th and 12th rib unless you are thin, as they are short and have 3 ends. The result of projecting a series of imaginary lines from the various points of the sternum backwards through the thoracic cavity, a horizontal line from the sternum angle intersects the intervertebral disc, the 4th and 5th thoracic vertebrae. This is the sternal plane and is another important landmark, as you will see. Suprasternal notch, clavicle, mainobrium, sternal angle, body of sternum, xiphoid process, costal angle, costal margin, mid-sternal line, mid-clavicular line, anterior axillary line, thoracic landmarks on the anterior thoracic surface, suprasternal notch, arch of the aorta, sternal angle, heart, descending aorta, xiphoid process, LAV, RAV, LAV, surface markings of the heart in relation to the ribs and sternum in anterior view, the anatomical position of the aortic, pulmonary, left and right atrioventricular valves is shown by LAV, RAV, respectively. The site where valve sounds are heard loudest with the stethoscope is shown in uppercase letter. Thoracic landmarks viewed lateral below the sternal notch is on the same level as T2 and xiphoid process level at T9. The heart occupies a midline position in the thoracic cavity between the sternum anteriorly and the thoracic vertebrae posteriorly. shows the outline of the heart viewed from the front, with the superimposed sternum and ribs indicated by gray shading. The heart is best imagined as quadrangle in outline, with the superior border being narrower than the lower border. The easiest landmark to locate is the lower left angle, which is the fifth left intercostal space in the midclavicular line. This position, labeled left atrioventricular, also marks the place where the apex beat of the heart can be listened to oscillated with a stethoscope. The sound is produced by closure of the left atrioventricular valve. As the left ventricle contracts, locate the apex beat on your own chest by placing your hand over the heart. Note where the lowest and outermost beat is, and then count reps to establish that your apex beat is the right place. If you cannot feel the apex beat, try to leaning forward a little. The apex beat is also the best place to auscultate the general heart sound, usually rendered as lub. The apex is the lowest and outermost point of the defined cardiac pulsation. Its position varies in some degree with posture, build, and height, and can alter significantly in pathological conditions where the heart is enlarged or displaced. The location of the rest of the heart can be visualized or marked out on the chest wall once the position of the apex beat is located. Trace the point as you read the description. The lower right angle of the heart is where the fifth right costal cartilage joins the sternum. The upper right angle is more or less in the mid-sternal line at the level of the third costal cartilage. The upper left angle is slightly lateral to the left margin of the sternum behind the third left costal cartilage. Heart sound. The sounds produced by closure of the heart valves are diagnostically important in many heart diseases. The actual anatomical locations of the heart valves are marked by bars. Note that they lie quite close together. When auscultating the heart with a stethoscope, it is difficult to separate the sounds of individual valves if the stethoscope were to be placed directly over the position of the valve in question. Clinically, the sounds of individual valves are auscultated where the loudest sound from each other can be best heard. These usually correspond to where sound is counted through a heart chamber or blood vessels. Their position are marked in uppercase letters. Lungs and pleura. The lungs covered by pleura occupy the rest of the thoracic cavity. Blue lines indicate the division of each lung into lobes. The right lung has 3 lobes, superior, middle, and inferior. The superior and middle lobes are separated by horizontal fissures, and the middle and inferior lobes by oblique fissure. The left lung has only 2 lobes. It is smaller than the right lung due to the presence of the heart. The superior and inferior lobes are separated by oblique fissure. You can follow the oblique fissure from the posterior to anterior by starting from the spine of the third thoracic vertebrae. T3. Continue tracing the oblique fissure where you can see that it turns to the sixth rib as marked. The horizontal fissure of the right lung corresponds to the line drawn horizontally along the fourth costal cartilage and rib to meet the oblique fissure of the mid-axillary line. The figure also shows oblique fissure, cardiac notch, costodiaphragmic recess, oblique fissure, horizontal fissure. oblique fissure, horizontal, oblique fissure. Costopharyngeal recess, surface marking of the lungs, dark blue and blue light, blue in anterior view. This lecture is now finished, and thank you for joining our amazing book.